paradise of the sea. Beautiful people, so strong and free. We give our hearts to you, whether young or old. I pledge my life to you, for you are my soul, my emerald island, in splendor called to you. Its ranges vivid, with love shines through. Your golden moonlight and your bountiful sea. Then now my island, you are heaven to me. Below my island, paradise of the sea. Beautiful people, so strong and free. We give our hearts to you, whether young or old. I pledge my life to you, for you are my soul, my emerald island, in splendor called to you. Its ranges vivid, with love shines through. Your golden moonlight and your bountiful sea. Below my island, you are heaven to me. Below my island, you are heaven to me. Below my island, paradise of the sea. Beautiful people, so strong and free. We give our hearts to you, whether young or old. I pledge my life to you, for you are my soul, my emerald island, in splendor called to you. Its ranges vivid, with love shines through. Your golden moonlight and your bountiful sea. pledge my life to you, for you are my soul, my emerald island, in splendor called to you. Its rain is vivid, with love shines through. Your golden moonlight and your bountiful sea, then now my island, you are heaven to me.
Ready?
Already?
Sorry, second. Hindi on, eh?
Merong Lawrence sa Real Palau Eco Paradise FM 87.9 material direct lome sergid ra PNCC Digital TV ra channel 73 nga alsa Lavlur Palau material lome sergid logyo a PNCC live streaming nga Real Palau alungil sila ko kami tatakubat sa press conference nga ngid LL ko tulurior lu medel ko singila ong ilbuil tiang atakubat sila gidela dito ko ra COVID-19 makulingit ra media magdakan fa na question sirgit di mara to COVID-19 el bornyango el question sa mi mo como re ma un delurior sel temel temel e do borang lulmud de como gere ma montira Edward mo muskitang lungu do mul Mr. Edward Anastasio mo muskitang lungu do mul
Era bodolulu akti tuli segi del vals tiang ada tigringi rabu gora Exodus segundo mora Deuteronomy dire kalanga Hebrew sel kumula se Dios ase I will never leave you or forsake you dia kabol itit dia kabol ikris kabo de telek le bodolulu damam lubu bul Dios ngayang agi magodong yang claim legi umrang lo sem peti garum kamam e peti garum rablumam kamal masaw raklangar other belau e kamal masaw retial blumam agi magodong yang claim e otorga kli tial niya special press conference legi umrang lo se kawa Dios lo magreu e ngari niya ungil mokte karkaw ulgiram kawa ungil madinge ya albangalam maberedela aurior kama algamama albangaringi melulu lo lingit lo se alom serengar kaw pol ngar alsil tirgal mga taklam may gigil bolo sa dal tokoy pol alak arang rir adal tiradir go wadig larang rir mal ubet tasweba karang rir algirela atokol kama maalbang ringi la COVID-19 agi mreng asule mletgeme wasen dia kamo pom itamam e malmol maldiom karrer kamam magyo lang saw e gulaw oling tay garro gul ngarang klelang algem Jesus lo sablam almorar amen.
Masaula Mr. Anastasio Seng Lungu Mr. President tau era kung may galom skawe di mo ay sarbululo sa tuwata o bangga ng press conference mo bangga al itasil sa ng tel tukubat sa press conference nga ni at nga kal President Rablur Belaul Surang Luip Junior, madirek Vice President Minister of Justice at nga kalchay udu Senior, madirek Minister sa nga niya Minister Public Infrastructure and Industries at nga Charles EROB ang madirek Minister of Finance at nga Kaileb Udoy Junior, Minister HRCTD at nga Kangilay Velas Matul, Minister Agriculture, Fisheries and Environment at nga Stephen Victor. Direk Lavang nga press conference afternoon na Miss Riter Udoy nga incidents commander EOC, Mr. Kafaru Erbelaw nga Deputy Incidents Commander EOC. Direk nga niya Dr. Ten Henkakal nga Medical Epidemiologist, Center for Disease Control and Prevention, Direk Dr. Haley Kias nga NCD Regional Epidemiologist for SAPI Pacific Island Health Officers Association, Dr. Victor Emiano nga Public Health Advisor EOC, Miss Landisang Kotarol nga Chief of Staff President. Tigay idir below abanggat nga press conference afternoon mga ulgyong sa President mo afternoon nga karira at media bo loger auril TOI sila si tilmutulo lingit si confine na question ni gidil di mo atora COVID-19 nga niya ito ko please mailmer ang rule mo draw and stay. Si President ako yung muskam mo makmul dadam nila afternoon.
Mal sulang Edward ra nungu ko tulo le mal lungilite asils moray budul maraklay marubul belaw bilong ebiraklay marmasil belaw President ra Senate marugul senators Speaker Anastasio marugul delegates governors legislators mar ministers mar adala Ministry of Health Incident Commander Udoy, Mr. Erbelaw, Dr. Hancock, Dr. Cash, and Dr. Yano. Susirgid mar other belaw rogul ngara lodeng sirgid rel al sils. Ngara ayang al mor hotchari gi mangara ikra blur belaw. Tuta mnari ko gigrel bekal mandem lo ngara a worshipper obviously sirgid rang rul muth. And you know one of the amno tapigan kal pastor jana amsadra Moses mananga Israel nga Israel seral tobodra Egypt and dim lakal stobol complain Dr. no mara ngaral albanglir niya dimrala munday digida mdayna sengari munday ngari adakt mal understand thersel el sebakring adra blue mun clow to trela adabera abway ekman mereng asulela medial tial special el press conference el mos inang artiang el clow to trela igel moral information al blaktak moral adrablu malakal clow around ngotru ule igida amlom denger sera ongi mulurior el wase ngari aterul adal narsel flight ra kwamel may el selera tel nombre kal Sunday amle positive le katumlar sel 5-day test kadam tigatir kadam milir igel verification masel midnight ra Friday igada no isra blue lo kadam la verify through an antigen and a PCR test was moral positive iga imported cases il tablo diregal over the weekend adadara EOC Ministry of Health sel dom kodori saying contact tracing aulumul mungulmul trigger rogul blal contact tracer tir lu imate walad blodo dengel wase te negative rogul dia tartir el positive te dimle negative rogul podría lo hacen botoga information amrara blue undi gida correct information so we'll make sure other blue aklavada randil was say there's no other cases at this time mal de gida imported case dice el wingil aiser sea tiagid agotrul trigger terul cases amlera nura blur bela la one flight meaning they're required to be vaccinated. So tamle vaccinated, and they were asymptomatic. That means dimla ka ngidil part dimla ka ngaral filengi malubang gora arakt el causer mong wala siyang marina ptrir ngaray I get symptoms ra COVID dimla. Uli ka dolom de set toba COVID kidam le tested tir. Makotrul ka sa vaksina ungilo urior rula adamong dekal san mosmer. Malubang dekal filra sa ya ungerong kadang sa testing system rigid urior. Kadang de emertir. So amle action hospital beside the contact tracing trigel terul el possible trigel del test positive amle masibro hospital ngarsel trigel tabsay igida dirgal el maasker trigel le contact tracer tiro se mara quarantine dirgal trigel tabsay gida of course in so del قطرول إن شاء الله سلب أكثر أضربلو ملاقلو بري داركت من أيها precautions بلالرون ملا بيا أوريل بلالرولا Ministry of Health ريد مال مرينا سوليا staff را Ministry of Health and Human Services مال نمرين أوريل على weekend الغوت مقلا يجاي جدا الرغون مرا عليا أمكلو توتلن إلى السيل سه مريا سالي دلغارتيان سيرا Friday ملنا تقلد الموضوع دورة دكتور هانكوك via Zoom. سيد التايم قدم له طرق قليل واسي كلو توتلل هذا دروت لو مسا يلوك ترتلا تستينغ ريدا تيبلو المساكل قد التلبيل واسي تريجل مليرا غسوس ومو تستريل التوتاو ملاس مالمورسيل واسي قد تسترتيل البورت سيل لغير لأدر الغرام ريجل 172 hours الوقية تست يمو مسا سكوغي سيو مال مودر سيلوك سيستم ريجل تايوان تنغر ايربورت تست ريجل مسا سكوغي من ديك سيد الاسيم نو ست مول نورغير مير تست سيل مسا سكوغي تيلوك كواما 172 hours الوقية من نورتور سيد ما recommendation ما سيو تمغلوريو سي مرغود increase سيد التستينج سيد الميتينغ هذا نوري أتى اللي الموضوع أدرام ريجل موضوع المرينا سولة أدرام ريجل أمباسادور أمريكال أمباسادور هنسي نايلاند النو سبعة لوريال لمترا أدرا CDC ما أولى دكتور هنكاغا ما دكتور كاش أموسيل نوسيل ميربلارا خصوص يعني أرتيال رول ساندي لو نسيورا جيد الروغوي أرتيال جيد البانديميك ما يجيلو الداس واسي نرا يجيلو نيل el tratar aurol dol tirakle er adre bela sel baak wada mringa sule la government trambrigel matrigal terur tohtan uknos il join together al sils I'm going to speak in English because I was told that last press conference there was no opportunity for the English speakers to know what was said, but first of all we had on Friday evening 2 of the passengers that arrived on the Guam flight tested positive on an antigen test. After that, Ministry of Health calls are to do additional tests with PCR to verify if they are correct. At midnight on Friday night, it was determined that they were verified that the 2 cases are imported cases and they were positive. Immediately, earlier in the evening, the 2 cases were brought to the hospital. They were put into isolation. And have remained in isolation, they will be in isolation for 10 days. Their contacts have been contacted, have been tested, and found to all be negative. 24 contacts have been contacted and tested negative. We appreciate all the efforts over the weekend for the EOC and the Ministry of Health and Human Services staff in testing and contact tracing and getting all this work done over the weekend to make sure that we're protected. During our phone call on Friday night with Dr. Hancock, we discussed measures that we need to take maybe to enhance our our protection. And I think one of the things that was determined early on was adding an extra level of testing. So all passengers that were coming in on the previous week were only tested on day 5. Now, on this flight that just arrived last night, the passengers were tested this morning, so the day after. And we're hoping in the future that we will test them at the airport upon arrival. That's the next level. We just have to get the logistics worked out at the airport, but that's the plan. On Friday evening, we also had an opportunity to contact Ambassador Hennessy Neeland and let him know of the situation and our request for help, for experts to come and help us, to guide us and give us good advice on how to best mitigate against the challenges with the COVID and the Delta variant. So at that time, our request went to the U.S. Ambassador. He worked with CDC, and on Saturday morning, he let us know that Dr. Hancock and Dr. Cash would be coming to Palau for 2 weeks to help us through this process and give us advice, best practices, and just help us understand COVID better. And so we really appreciate the assistance of the U.S. government and for the 2 doctors to be here with us today. We just came from a meeting with Palau's leadership and had the opportunity for open question and answers. And I think this afternoon our goal is to be able to discuss with the media openly questions about the people's concerns in the public, especially on should schools be open, should we continue life as normal. Those are things that we want to discuss and make it clear what our direction is. So a simple answer is yes, schools stay open. Everything stays as normal. We should follow those best practices like wearing a mask, washing our hands, social distancing. Those are good things to do. Doesn't matter what kind of variant you have, those are good things to do to help prevent the spread of COVID and keep us safe. But most importantly, get vaccinated if you haven't. Maloise, ibay kung telteal المسا كفار مبول بس كده update الجيرة تيال الكوفيد هذيك ترى ترجال من الدين رجيد من بلور أمريكا لا help رجيد لو مس كده otherwise هذيك القرا no sé رجيد لا يجل كوني لورو لا يجل بيبي رابلو لا سأل help الصوب كليدر تيال تقرا كوفيد هذيك القرا يسجل راسه مرة يجل بالطيرة حقاسة مرة يجل لونيل دول تيراكل الثلاثة أورول جدا أمرور أسباب تيار هذا البلد ويصير دي بوقتو يجي ده قولي تراجع فارم البول بس كده update سولا
Sulang Mr. President malungil tasil sa mga beklat. Aktin mo to kamo to elabebira details sa ikel tablol case. Again, hindi ka at time hindi ka tu. Madingil lasing ngariya tokol ay sa marara social media lo setam lamot tewang lamot telol me te with 10. So sa mga clear sa at time mandir ka tigil tablol case. Tamalmol mga isolation. Kung nasa namo sa idolo ay sa tirka other belaw ta other belaw mlara merigel el may nasa igid el flight imol dadil ma imol saal ta malmutal al time and ta asymptomatic bulgulak mundia ka kora ulang alelarak tan ngartir ta infected malmol ngara isolation or hospital sa igid dila president 10 days president tamlo dula o 24 initially mlari nga 24 close contacts at tirgay del positive case el mildang eli melang arian mutel teru mong till 26 am la test negative mutel me test ra day 3 ma day 10 so agi la issue tira quarantine order et mutel mo test tira day 3 ma day 10 tirgay teru positive case ngara isolation el 10 days sa test tira day 10. Okay, close contact mabulgulak mo other surveillance ra Ministry ra Health and Human Services milngit mokra investigation al interview tikal positive case loger tira tokol badingila ager dimuk ringi agel wase gom larger tawat al ada misal qura man lukme tiril within our 6 feet kasingiling at least 15 minutes. Ang kakaru sa criteria al ada mo umatang at mong close contact masigi damle result sa igid initial contact tracing investigation tigid 26 mga tangat taling so far at negative hindi again malmol naman ni tortir mutul mo test tira day 3 ma aday 10 mong suadal qora din mutul maklat ka adra bulul wasel sugum dir ka umqadong orqaw ak madangel se kada turqok kal madan tirikalat tokar adril detail na ay sama kada malasam mga lakran ng dir adra bulul wasel sugum dir ka kamwa ading water other hospital wasel loam lek med tigalat ing lahmal galit elem le close contact tin hindi suadalo o ay sa adra bulul wasel urior amalmol hindi ka dilbor se stop kada malmol lo mesa ra situation malmol motmok ra contact tracing at sugum diri nganiar made el adal el tira amlok med tigal positive case direct kal suadal el makataklis el tokora testing beto ka a question el girela tegid el delta variant tamsal el makatakilo se gel test el low level el all time ra hospital ma klinik ra Dr. Yano asab el dong ingal raktel gal armela COVID-19 gel SARS-CoV-2 virus hindi sel mo malang alwaseng gangaral variant gireda lol durok ra a specimen el moral level nga ra ablura marigel mase direct kal gimot mo kuring lurior gi malas manul durok legel el sample ertigal terul positive case el mamara ra adurstel ngarsel APA flight mong tangat lang at yang Dr. Hancock direct kal sa el qura musugi ter segid el process el durok legel mora ablura marigel el mora sequencing el mo omesring la sing mal ngaral el variant hindi el time kada madingil lo sing positive case kita mangira result ter segid el sequencing direct kal suadalo ay sara adra bulul wase segid el plan el bled announce ringira last press conference el wasing ngania mitigation plan el bled endorse ringa NEC segid adul tuiringira tokoira community mitigation mong betoka question el girela school magirela siobay ma aureol wasing malmol malubendia betoka gel girela amaklol gor ondib ma kamaldil mong suadalo ay sara adra bulul wasing ngani segid el plan el endorse ringa NEC el alwi kagi mo geko kumamel lo tob dringi olisakra adra bulul wasing sing mal ngara bulgul wasel sugumong lengelak tela el gays al sela bulum la kadana morang ral stage al sugumong require a lockdown ngoy ngarang yegita ko ra details ng al sel segid el mitigation plan di close to tlela todo al time masero egel bladu president kadaman mol ngara amrula gel dorul hindi kita di mo korigik bay direct kal soma men utte al mal mal sulir adra bulu lengwal di ka meirel tob de la sempre como mask igitel ngar se tel yo mask rogui ada por abevira shoba di tilm la otobda tigingil lo se o vera ablima mengiri lo mask mal ungiri makarang gidia dobre ga sulir adra bulu gireleng wal dilgi del teg initiative el motmok la preventive measures endi segi de adol tirak segi del mitigation plan yang wal dia ka a mandate tra Ministry of Health and Human Services el time el mandate anything beyond regel ngari el time endi again dia ka tomera shoba el sumguk tingil soal implement tegel el sorry implement the preventive measures mong segi da ko kwat tele lauriol moving forward el wasera mo omesa segi del mitigation plan direct el alblalut el reactivate IOC agi mo gil amol top da daily mutel mo daily sel situation report mandial dil bekkel sunday mo bekkel sil sa el top da cook updates el mara media mar adra blu umda segi kita ungil updates for now by real mo questions
They come summarization to Maria.
So just adding more details to what has been said about the 2 positive cases. So again, we remain with only 2 positive cases right now in Palau. These 2 cases are both Palauan citizens, one male, one female. Both traveled from the U.S. Via Guam on the August 15 flight, and they were tested positive on their day 5 test on August 20, and as the president said, they were confirmed that evening. Initial close contact revealed, contact tracing revealed 24 close contacts to both cases. They have since tested negative, and they're placed under quarantine for 10 days with further testing on day 3 and day 10. Today, there were 2 additional close contacts identified, so they too are mandated the same quarantine orders and will be tested on day 3 and day 10. So far, the 2 positive cases remain asymptomatic. They will remain in isolation at the hospital for 10 days with a test on day 10. Again, we want to reiterate that contact tracing is ongoing. And if you have not received a call from our surveillance team, then there's very little possibility that you are close contact. So we know that there's a lot of concern in the community that people might have seen the positive cases. I'm pretty sure some people already know who they are through their relatives. So again, we have to we ask for cooperation and patience, and let our surveillance team continue with its contact tracing work. Another initiative that we will be looking at and working on this week moving forward is the community mitigation plan for COVID, which was endorsed on Friday, well, I would say Saturday morning, by NEC, and that plan really spells out what mitigation measures are required at what stage of infection or community transmission if we come to that. So that's one of the activities that EOC and NEC will be working on this week and next week. I think I also failed to mention the school mitigation plan, which is ongoing work with a work group that includes Ministry of Education and private schools, principals, and Palau Head Start. So we know that the unvaccinated are those under 12. So that plan will start focusing primarily on the kinder to 8th grade, on that age group, and really looking at how we can keep schools open, but at the same time make sure that we put mitigation measures in place to reduce the possibility of COVID transmission if it comes to that point. So those are some of the ongoing activities, and we're thankful that Dr. Thane Hancock and Haley Cash are both here for 2 weeks, and we'll be sure to utilize their expertise and advice when we engage with our partners from the Ministry of Education and others in doing these plans. So that's sort of a work plan moving forward while we continue to monitor the situation with the positive cases. We will also reinstate the daily situation reports to the media and to the public via we have an email listserv as well as Ministry of Health and Human Services website, and numerous profiles on various social media channels. So we'll disseminate those daily situation report and then press releases as they are issued.
Oh,
Yes, just want to also remind that there is vaccination on Friday at the National Gym Pod. So any remaining 12-year-old and older who have not received the vaccine, please come to the pod on Friday. 2 p.m. to 6 p.m. is operating hours for the pod on Friday. So again, any remaining 12 and older who have not received the COVID-19 vaccine, please come to the National Gym Pod on this Friday, 2 p.m. to 6 p.m.
Edik waktuli gafal wase tial the face ringir al sils langare gal tablol positive case is what we've been planning for. Mlamo 18 months ra da sisabra COVID. Gadamral mrenga sula la Ministry of Health and Human Services ma team tira gotem le blagaran el first that masab akhrigid umle mrenga la quarantine and then mrenga la urior el vaccinator to get us prepared. Back in March as al misel team ra HHS at gadamlat magi say ilang giria del masamo crowd the swed el mom say namoda kadangara namoda gir dam dasra COVID free kadam dasra COVID safe. Mong Dr. Hancock ira itang artikel bangget maybe help artikel discussion ma direct opportunity ra media logera agir. So I just wanted to say that first of all we've got to be thankful for the tremendous effort by the Ministry of Health and Human Services and the EOC team to keep Palau COVID-free for a very long time by implementing quarantine measures that have kept Palau safe. And then launching an aggressive vaccine campaign, which has ended up being the most successful vaccination campaign of any country in the world to date, with vaccination of the total population exceeding 80%. So back in March, when the team from HHS was here and we had meetings, I think one of the things that we talked about was preparing for this day, that when we have to transition from being COVID-free to COVID-safe. And that means when the people come and they have COVID, we contain it, we protect it, and keep the people protected. And I think that's where we are. So that's why we continue to go to school. The flights continue. But what do we do to mitigate and make sure that we're safe? Masaya ulo kada malmol mal mora school, lemru la iger rogul gira dan mrul, mas kogi dir kame, hindi kada masa sengara iger baby rasa dan mrul, lutso bakti dan kada klagar. Jadi lungi la baik ma ulan un sa ira ite Dr. Yano, ma Dr. Hancock, ukla boldu say, and then maybe we could have a question and answer. So Dr. Hancock, Dr. Yano, I give you the floor to begin this next phase of discussion, and then maybe after that we open up for questions and answers.
Okay. Thank you, Mr. President, and thank you to inviting me, allowing me to come and continue the collaboration with Palau. It's really an honor to be here and work alongside with your team. This pandemic is certainly a historic time, and I think it really has demonstrated the strong and enduring partnership between the U.S. government and Palau, and for me to be able to come and help work with your team is a continuation of that. And I have to say, Palau is really amazing, just a global leader in taking on the pandemic, utilizing the vaccines to really create a layer of protection that is unprecedented in the world. And so I think, as you move forward from when you first, prevented introduction, and then Palau came up with the Palau model for getting people into COVID-free areas in a safe way, and then really performing and carrying out a vaccination campaign that is amazing in its ability to prevent or help prevent COVID-19. Throughout all of that, all of those things that you did and everything that is being done in the globe is really in response to COVID-19's ability to really cause severe illness in some people, can cause hospitalizations and can cause a lot of hospitalizations that overrun the hospital capacity, and unfortunately can cause death. And that's why throughout the world, countries have struggled with how to respond to this. And I believe, Palau is way ahead any other country at being protected from COVID-19 and the effects of the virus that we really worry about, which is that severe illness, hospitalization, and death, because you have put in place what CDC feels is a foundation of really addressing COVID-19, and that is good vaccination coverage with appropriate vaccines. And Palau has done that. And so your first major layer of protection against COVID-19 is there. And we know that the individuals that are at highest risk of that severe illness are people that are older, people with comorbidities, and those people have generally been vaccinated in Palau. So that's fantastic. And then I think as the Ministry of Health adapts their approach to the changes that are occurring in the pandemic, especially things occurring outside, I think they're doing a great job of adding additional layers of protection. And of course, one that's been there is sort of your entry process, and your systems were in place to try to identify COVID-19 when it was introduced to Palau. And these two cases, I know they may cause some anxiety to the community. They're actually a demonstration that these systems are working and that you identified those cases and your team has been able to isolate them and do contact tracing. Now, so I think there's certainly things that the Ministry of Health looking at schools. I think you may have seen in the U.S. we found that schools are really important to keep open for the kids. And in this current setting in Palau, where with just 2 travel cases, you definitely would want to keep schools open, but also down the road, and the ministry is already well ahead, thinking about what are those additional layers of protection that can be put in place to help protect those children as well. And so I appreciate the opportunity to be here and collaborate with your team. And also, I think you folks know that, our support with vaccines and, other treatment modalities that help prevent hospitalization. It's really fantastic that we have that close connection and are able to help provide that to you folks. And then seeing just how fantastic Palau has done at protecting itself during this time. So thank you for the opportunity to be here. And I'm looking forward to the future collaboration with your team.
So long Blas, the last mole mga deba igel dal mo igel maklol gora dai ratigingel mong laseng nga ka aurora guam lo relevant adra CDC lo nga sa igel blura Associated Pacific Islands mal mrenga sulela قبل بلا ما بريزيدنت الشو تايرنيل مي من سبيل لوبنجيلا تيم MOH Minister of Health ما Human Services لو مسيرتير تيال response الجيرلا ايجال تبلو الكيس مون كل ده مقتغرا ايوبو Girel ol kabay, ay gel mringil ser, ay gel duk mun severe illness. Ngol kabay, amon New Yinger Hospital. Ol kabay, ser sebed el mosme el madringi. Seguidia while gotel level, sel while gotel blab el, urered el tomer tal ser. Seguid el lurior, malungil al sugu marbek laad mal uben betok laad rablu amla mayo bortir seguidi agot protection ongerung ay gal dosad el melgo tiging la mask ma meeting lo mantirar betok laad ma meeting lo ngar al selablay ma school mung makray ekadosig al do ulel إذا mga sadar تيال سير من داخل المويول أي قال تبلول سير أم ليل وجيوا أمرايل دي ملاغ السير الدلوب رابلو ملاغ أمرايل مي من ملاسيت أي قالوا ريول بلام رول Ministry of Health الملان الترقال أذر أمرايل أو ريور عندي تم التقرنيك ملاسين tara amosib irulia di merda ada bolgugu etamalang ringi diagal ilil mo ngey meludor ubangay meklubse ruri tadong ira kotel sils el mut el malang ringir o ngay mluror le selbo do ngay e gadmom dingek mlaseng kadmagarang magdmo selba akla mang malmol muk mlaseng a school aguk mongod atletelel ending ngartiale rul sande mang mamalas mluror lo bantirir wakafar el mrul aigel plans aigel dorul el mangsadar ti alser mandegal lolmol malubeng ngomer garablu. President idido Isaac mo EOC lilut el activating a president mong serial activating arwa ka faram la morior mong tirgagi del weekend de tulurior mong kamsulang or segi del activation president.
Namaste lo que era que Malungil itasil si president ma Dr. Yano, Dr. Hanka, Marbekla. Akari ka tablong ak mo kera bebila atikani akarir. The first question that I have is to Dr. Hancock. We, of course, he says we don't know yet. We don't have the capacity here to identify whether it is a Delta variant or other variants. And the process of testing has been changed, so it's now going to be when they arrive the day after, they will get the test, and then another in 5 days. So for the Delta variant, how long is the incubation period? And so are these testing really going to show us anything once it's been done? And also we heard from Guam that there's a growing number of people that have been infected. They also they're vaccinated, but they've been infected, they've been hospitalized. What's happening in Guam that's we can learn from and probably help prevent that from happening here? That would be my question to you. And then my second question is really to the President. You know, the concern that's you hear in the public and possibly been disclosed to you is people want to know if this is coming through Guam, why won't we close that access and fix and resolve this issue locally, or is this the new normal? And that we should be continuing it while we put in place mitigation measures. So what is your, what's the thinking behind the policy? So those are just the two questions.
Okay, thank you. Yeah, really great questions. So the first one regarding the testing, we won't know for sure. We won't be able to confirm the testing of these first two positives as far as the sequencing results that would tell you what type of variant it is. We'll be sending those off for that confirmatory testing, and that result will arrive later. Despite that, waiting for the testing, just because of the patterns of transmission outside, both in Guam as well as the rest of the U.S. and globally, is really dominated by Delta variant. And so the Ministry of Health is moving forward and acting like, hey, this is probably Delta variant, so we want to respond as you would if it was Delta variant, and then would find out later, but automatically just sort of responding to it like it's Delta variant. The question about Delta variant incubation period. So one thing we found about the incubation period is the time from somebody's exposed to the infection to the time that they actually start developing symptoms. Also in there is the time from when somebody's exposed to when you can actually do a test on them and they're positive. Because as you can imagine, you may get exposed to just a few number of viral particles, and they start growing in you, and it takes a while before the virus has grown enough before the test can identify it. What we found with Delta variant is that time for the virus to grow is quite a bit faster than the other variants, meaning the median time, so the time that was sort of in the middle of when people would have symptoms for the old variants was about 5 days. They're finding that for Delta variant, it's more around 3 days. And what that means is people get exposed and the virus grows much faster in them, and they can be infectious earlier to spread it. But it also means you can test them earlier and get a positive test earlier. So it may sort of help with identifying the virus earlier as well. And my understanding is because of that information after our discussion, that was one of the reasons why the Ministry of Health said, hey, let's add another test to that screening process because we know that the Delta variant is going to come up positive sooner. Your next question as far as Guam lessons. I think one of the big lessons from Guam and the rest of the U.S. is that Delta variant is amazing at finding and infecting unvaccinated individuals, especially adults. And when we look at both Hawaii and Guam that didn't have the coverage rates that Palau does, but had fairly good coverage, the unvaccinated community is really lots of spread there. The individuals that are unvaccinated and in the hospital outnumber the vaccinated 9 to 1. So it's like 90% of the people in the hospital are unvaccinated. And because of that, the Guam governor has actually said, hey, this is a pandemic of our unvaccinated in Guam. And they've put in some recent requirements for people who are not vaccinated that they have limited a restriction of movement. And that's where, again, I think Palau has really maximized that protection that vaccination provides to your community against those most important aspects of the disease, severe illness, hospitalization, and death. And while no vaccine is 100%, so that's why, when you have a lot of transmission from unvaccinated people, there's going to be some spillover where you're going to have some vaccinated people that may get sick from COVID-19, and we're seeing that. But for Palau, the fact that you have such good coverage, that really reduces the main thing we're worried about COVID-19, which is not really transmission. We're worried about transmission because of that severe illness, hospitalization, and death that is what the vaccine really reduces. By about the vaccines are as good. They're finding they're as good against Delta variant really as the other variants for preventing that severe illness, hospitalization, and death. So while there is maybe a little more transmission with the Delta variant because of we're talking about the incubation period, it's still, the vaccine are still exceptional at preventing severe illness due to COVID, which is really our main concern. And so, in our, like I mentioned, in that whole response for COVID-19, the primary foundation of any response is good vaccination of your community with a great vaccine, which are the vaccines that you receive from the U.S., and you guys have obtained that good coverage. So you have that huge foundation there that really helps keep Palau COVID safe, even in this sort of changing situation at the moment.
Second question.
Okay.
Do you want me to repeat it?
There.
Oh, okay.
Arun ko mo leader sel tingin lang tora belo. Okay, come on, Lucille Mongin. Di gotrule kida wayir tilum. Budul mura process rigid. El vaccinate ra adra blur bela tia ul mura January. I remember and the election and that was probably the first time I had an opportunity to meet Dr. Hancock on Zoom and Dr. Cash when we were talking about vaccines coming to Palau back in November of last year and trying to find ways to make sure we could get them all here and get people vaccinated. And I think at that time the thinking was as soon as everybody is vaccinated, life is back to normal. Unfortunately, that's not the reality. We've had to adjust, and we still have restrictions because life is not completely back to normal because you want to keep people safe. But we know that we have to continue living. We have to continue making sure that people that are ill and need medical treatment can go get medical treatment. We have cases of people here in Palau that have waited for medical treatment for 8 months and did not have the opportunity, and now we've lost them. That because they could not leave. So having flights available is also a medical emergency to making sure that those people can get the treatment they need. It's also bringing families together, students to school, and getting people jobs that they need. Because some people need jobs to survive. Other people maybe not, but some people, I think a majority of the people need jobs. So, kita ulmura tial nomrega raba November. Tial uldaso mamalay gal vaccine el me uldaso sel time la se ndi mega vaccinator adam nam kadalamo ni mokl mrula igel so. Ndi kada nam tigering la se auri ura gal nam hotel al buil ndi kada sal mor seigit. Kada la vaccinate ndi kada man molmal el gargik lendi gal so dal me araqt lo prid en ngari ar adal el mosmer kada mal el mage gogid o meseringi am subari ndi dul dongale atiagir kada nem dangel wase sel bodam regal maigal vaccine en moria time en yam sois betia raktra ablur vela ma dururi am ruri da sem kada sel ba akla sea اقول قدم لا ارتيال يوبو قدم مرور جدا موصل بعقل مع السوم ومسويس انديق الوانا التملي تيال بلو هلا قوس بير اكزامبل الاسبانيا دكتور هنكاغ سيدر واسي تيال فاريانت مالو تيال رقطة السل سوم نال موترا يلم دي ديرت الأوتما ما أوريوملا إن ديت موته مال بغرورت المراينا ديل سوم مورا أباشيول أوردي ملام تنغلا أولرينيه هديمس ngade kal sal sebel ngidre lal sel bla ngai gal yobo engwa bla dik masi tial oreo mal matial ut mumlamo meri riat mauta ngawri masea ule gada udul turu klil wase oi kada openera belwad matamaral merat digina igel doru la ule ndriga mal mal ngari testing taiwan amal ule gada tester tir airport mgadna se laster te lire edi merbela li maktub sel muter marail akwam هذا تستر تيرا غويد ميرول سيغان روير المي 5 days after المي دي لازم تيجي نسيب ميبي غير تيجي الامرسل بدا تستر تير سيل لغير ديرك اجي هذا المول مال ادجاست ميك شور ابل وضع سيل باقل مراد نغر على سيل اسد من المول ما يجي كده جاد المرور هذاك السيلز انا كده سين مرا سكول هذا سين مرا ستوا نسين مرا هوسبيتال نسين مرا مرور يجي مرا قمل دي مرور يجي رغول اكتيفيتي ني ريكوير على سيل اخلان تير هذاك السيلز من أقريما واسي كذا من المول مرتيال ضروري أقوم مرال واسي كذا من المول يجي لغير ألف من المول من لو مس ريفيو ميك شور كذا أصل بعقل دين سيادة من المول ما يجي الأكتيفيتي الضروري من قدرني يترك اللوري غير بلو إمال غير يمر إكسامبل يدير لو عملوا الإكسامبل واسي البيبي راتايم إن أجيري هذا الدقة بإيره ثم إذا بتقول هذا الباقلين sometimes إن ديوان الأدم مر أرى برتقل دي مودي هذا ويسبلور روغوي نجير هذا make sure إن ده غلسان مؤرر من سيد رويل أوسيد اللهم داسو ومثل جيرلا كلنا لا بيلار روغير مر أدر روغوي لبيبي راتاي من وقتي وانا الأرى كذا مالمو بول الروغوي مكذا إمام مضاقت دي كذا نيترق اللورين على أدر بلو إذا ده قدي تقرأ دي بيسا تتاسد ترليتيان دول تويدا أرسمون من قدمنا المريض سولة لا بلور أمريكان لأن ده قال البسكيتا يوبو نترجع الإكسبرت CDC اللي يوبن جدرا ترجع بكل ساندي بكل لونيم لوري بيسي غفار لأننا كل لهم جل مينستريا هيلث اللي قدم سادر بيلاو ما يجل دورول يت ريفيو مثلا سنجرا نكسل دورولي من سه تجدر الدريق الستبرة وقلل مريلا الدريق نريال تقلد الوقت تميل وإلى التامل تقوبت سلموسو جد اللي واسر المرأة السلام مارج الدريق اللي نسير جدر أو لاسو لو مسير واسه يقال بيبي رابلو المليك رجيد ما بلو الآدم وعرا رقتري ينرا يجين مورو لقميا مويل سل بعقل يميرا أرابلو من قد Agumra lo se adilla da malmol el maral بدول سel el donda suria bebe atam ka tibel adjust ra sending di maral ndeka umda sing ada kali gira del ukmal mobil to tetelu tendi tidak tahu tangale doktor yang ngira ite agumra lo se amokte kali da se aikal plan lagi ase da adjust ndeka di derel lo se ndi tiegi demro al sumung ase se ban namo da kal se da control lagi ekada change the plan di adomrani del altama se a plan lagi da urior kadam de mertigat teru which means a testing works mungkin moklorud ya system lagi da urior marada alzheimer lagi da moklorud em dengan se kadam mol masagal plan lagi tigang artial masur lagi el mutra masa sing raigel se adel sumok lu transmisi sudah.
Good afternoon, Mr. President, Dr. Yana, Dr. Hanka. My first question is for the President. School is open, and what about large gatherings like the night market, sports gathering, and funeral? Is that will that stay? Will that go on? And for Dr. Hancock and Dr. Yana, I think the concerns are for the unvaccinated individuals, including our children, the unvaccinated children. So how does the Delta variant will impact our children? And there has been a report that it has been children are impacted. So how can you explain that?
So, first of all, thank you, Bernadette, for that question, and I think it's an important question. So, yes, schools remain open, large gatherings can still happen, night market will continue, nothing changes. We believe there are imported cases, the cases are contained. We're fine, but we should always practice good measures, which includes mask wearing. So if you're in those large crowds or in enclosed spaces, wear a mask. It's not mandatory, but it's a good practice. So we encourage it. And I'll turn it now over to the experts.
Go ahead. The question about the
children.
kids and the children.
Well, maybe you can say that in Palauan.
So, yeah.
Agotru ule selgera gera se mungkara school may gal maklol segab kadamal mol odis abes ma mlagera se kadam kara gal maklol on dibel marwa school ay gamal mol mal ngaringi activity kadamal mol mal mora school mal mol mal mora gamal di mal mol mal el murula gal activity wa night market liwa eli di ndire kalungil ada practice ay lungil practice ergi deba sel maklol sega del el simra al sel ablay en mo masking malungil aya sel help el sob akla mong sel akto to tell message ay betol el blol غفر blol masad el wasik girer mishu imad girer distance ay girer practice rabek time ya gumda sel tara blada subira adr bela ومال ويلا يجلو سيساق ميتيل دريغا دولو سيمو ماسك ميتيل وماسك روغوي مكمال مسودان لين سي اول اوتيل سي كده غريق لا سواد السبع كم سولا.
Yeah, thanks. So the question about protecting the unvaccinated, especially the kids, right? And so in Palau, yeah, those aged 12 and under are the only individuals that are not eligible for a vaccine yet. And yeah, that is kind of concerning, right? When you think, oh, okay, well, we've got people who are older that are vaccinated. But there's some things that can be done to protect that group. One of the most important things is making sure that if you are an adult who have kids, that you are vaccinated. And if anyone who's around kids that are 12 and over that can get vaccine, that they should get vaccinated. Because then that really helps limit the spread from adults to kids. And in through the history of the pandemic so far, now it's changing, but it looks like originally a lot of the transmission came not from kid to kid, but from adult to child. So if you are unvaccinated adult and you have kids, you want to protect your children, the first thing to do is make sure you get vaccinated. The other thing, we talked about the layered approach, so adding additional layers of prevention. One thing I'm sure parents are worried about is school. And so right now, again, to reemphasize that there's not community transmission, so that we know of, so that allows for schools to be open and those sort of things. But there's also things that can be done if there is more transmission that can help reduce that risk for kids, and that's mask wearing and those sort of things that Ministry of Health has plans for and are revising the plans as they adapt to the additional information. But the last thing is just to reemphasize why have we gone through all this pain of isolation and rolling out vaccines? It's all of it is to prevent the severe illness from COVID-19, the hospitalizations, and the death. And fortunately, although Delta variant does cause more infections across all age groups, and so therefore will cause more infections in those under 12, they still have extremely low rates of severe illness, hospitalization, and death. So that's another benefit that although kids are not vaccinated, the number one reason why we're vaccinating is to prevent that severe COVID, and it's very rare that they have that already. So that's a sort of one of the fortunate things that we have is we're dealing with COVID-19.
Umilage mudlong ngal Dr. Hancock amelgot na se tararolel egda masabak tirgal ngariar krir truma erung atirgel maklol adl lobtitrir lo ngalgartir amma yobo lesel nga yobo etabay sobak klingal ngal ngaringa kora ewatlel ndabol ser direct malgot na sing delta asab elimur arbetoklat ndagdil makloma ngimur arbeklat age group nding dagal malgot na sing ser morangal ka adagal boligel maklol ser الدغبول نيوينغرني الدغبول سيل مادرني من نيمول نجغرل سير دي تارولل تموس باقلا اترغال مقلول اذلو بنت لو بتتري ترغال غالغا ما يوبورتير من ندغلو ليورني لتم لم تيغل كلاسي ندغل غالغ لو يولي مورا ترانغال غراسكول ngara klol adl morangal
President Ungilita Silse. First question na nga kakti follow up persel karila Miss Raklay. Concern ra public wase understand sel omol gorangira sendial close travel ra between Guam bela do sparing mura school Michael for many other reasons. Aba I concern ra adangar sel 3 days still 72 hours lungwa testing was it they have the COVID or not say gidel 3 days al bagi clearing was silsile de club same by sub ila adal ngwa rakte ngul merbelaw ma question nga kasi kautel mlaw is was ka mo test them ra a day after say gidel 3 days and degal diregal sub directly si ila blur belaw Chester say gidel muktul ko pangil mo itel do urung ira Taiwan mang instead ra by protect ra era ligir ra balur belaw stop airport
yang kontrol malung ilger kida ablura Taiwan mal mle urula bangiet egut mukli selo asika testra al sel airport tru era ngasar askogi se urera Taiwan le Taiwan trigra da walomu ursel blura Taiwan rogui emer belaw akoma tribal moda ler adangara hawa el mel kanek trakwa mangara siaba le mel kanek trakwa igade batemin ngara kwam mamring ergi da tester tir rakwa me edega testing capability rakwa مسأقول أساس تو عمله وداس واسه تيجي بلا سوبي واسه بدو لين ترسل أمارس سلغير دربلاو يقدر تستر تيربلاو قدمنا prevent and send 72 hours ahead دي is an extra measure سلغير دربلاو يقدر مو تستر تير سلغير إذا كده أمو extra global ما سبق أخرج so كده أقتولي تقرأ أمريكا دعني
Next question to the medical expert. For the two individuals who were tested positive for COVID-19, what's the science behind it? As I understand, they were vaccinated. Were they able to transmit COVID-19? And did we dodge a bullet on this one? We were just lucky that they did not transmit COVID-19, or is it that since they are vaccinated, they were not capable of transmitting the virus?
Yeah, excellent question. That's one of the changes that Delta has made us face. Is that previously it looked like the vaccines, if you were vaccinated, the chance that you got infected and then were able to spread it were extremely low. And if you recall, CDC said that if you're vaccinated in the US, you don't need to wear a mask. You're okay to do that. But the science is starting to show that perhaps for Delta, one, you have a slightly increased risk of getting the infection and also potentially could spread it. So that's why CDC reinstituted mask policies across the U.S. And that's one of the reasons why Palau is also looking at, you guys had changed your testing so that you can identify folks earlier. We don't know for sure exactly if somebody who's vaccinated can spread it as easily as someone who's not vaccinated, if they're one of the unlucky ones that get it. Despite that, being vaccinated still provides you the most important protection, which is the vaccines, even against Delta, are very effective, supremely effective at preventing that serious illness, hospitalization, and death. And they do help prevent you from getting infected. So then, therefore, help reduce that. But the big thing is that the reduction in severe illness. So with these individuals, this is one of the reasons why the ministry had the testing at 5 days, is to try to identify, even though everyone's vaccinated, try to identify if there are some breakthrough cases and being able to identify them and get them isolated before they spread it further in Palau. And so it looks like the system has worked this time, and it looks like the Ministry of Health has adapted the system a bit more to enhance that as well. But again, the protection level that the community has because of the vaccines against what we are most afraid of from COVID-19 is Palau's got the best vaccination rates in the world with the best vaccine. So you guys, that protection, that sort of COVID safe that you guys talked about is a really strong foundation that's really protecting you to an amazing degree.
Riter tirgal gidel teru the quarantine el 10 days tirgel mle close contact the quarantine al up the tirgel mle close contact the ngarab la self quarantine ngara tirgel
sulang ragel ngarila tirgal case isolated tangara isolation el 10 days tirgel close contacts and mildang self quarantine monitor the vehicle seals and other surveillance and monitor tir egiril metest day 3 ma day 10 so far ang tirger rogul close contacts direct gora dia symptoms 13 o mesin der tiram lamrus mong direct tara added protection and ding say the self quarantine matokol mortia sa hindi kalomais unless ang tamo siga gurula adra ministry rahel melmol monitor tira vehicle seals imro tame test ra day 3 ma day 10 hindi tirigel positive case adi ngar isolation of 10 days imro test ra day 10. So the question was quarantine arrangements for the close contacts and the isolation protocols for the positive cases. So again, the positive cases will remain in isolation at the Palau National Hospital for 10 days with a test on day 10. The close contacts tested negative on day 1. They are self-quarantining with restriction of movement requirement so that they shouldn't be out and about except to seek medical care and then come in for testing on day 10, day 3 and day 10. But I think so far all 26 remain asymptomatic, but the Ministry of Health surveillance team continues to monitor them daily with their situation.
Salam, Mr. Presidente. Muluay sa pungani tigal terul positive COVID-19 and telat club segom sabil momdet na sitiram la model Algeria tel na model positive ma kada taying artir en ngari akar lo lai tiragi COVID-19.
Dr. Let's ask the question to Dr. Thane, Dr. Hancock. So the question, Dr. Hancock, is what's the appropriate number of days that we quarantine them and then release them? And then do we give them any medication or what would be the appropriate?
Yeah, excellent question. So, so far, CDC recommendations have for if somebody is infected with COVID-19, the current isolation recommendations are 10 days of isolation. So, is if individual isn't immunocompromised or has severe illness, they find that after 10 days they are no longer infectious, and so they can be released. There are a few individuals that if they are severely ill, let's say in the ICU in the hospital, they tend to extend it longer than 10 days. So it'd be 20 days. And really it's about, and you want to make sure that the person no longer has fever. For these cases, they're asymptomatic, meaning no symptoms, so it's 10 days. For quarantine, which is when somebody's been exposed and you want to keep them sort of sequestered away or away from others so that if they do turn positive, they don't spread it. That is also 10 days with the test is what CDC recommends. Sometimes there's even recommendations, CDC says, well, maybe 7 days with a test could be acceptable as well. But there's different sort of risk levels. So sometimes for CDC, because in a lot of states, there's just so much transmission. They can't do the full 10 days, and so they do the 7-day and test out. But 10 days is good with the test for quarantine. And Palau may be having something that's maybe a bit more conservative or in line with that.
And then medication.
Oh.
He's asking.
So for medication, in general, there's not really many medications for asymptomatic COVID in general to speed up the isolation period. But Palau does have access to several medications for COVID-19. Some are for severe illness. If somebody's in the hospital, there's medications that can be given to try to help them recover better. And then for individuals who have COVID-19, especially early in their diagnosis, who are high risk for severe illness. So again, I mentioned that our goal is to prevent that severe illness. One, the major tool is vaccination. There's also a infusion, and that's an IV infusion that can be given to people who are high risk, who are infected with COVID-19, and you give it to them before they need to go to the hospital. You give it to them just after they're diagnosed, if they're high risk for it, and that helps reduce the risk of them going to the hospital. It's sort of like an early treatment, and Palau has that, just received some new infusion, some of that medicine as well. Right now it's called RegenCove. And so that's another tool that Palau has to maintain its COVID safe status and help protect its hospital and protect people from going into the hospital.
So mada
Nga mo itay lang doctor yun.
oi. Ger amlara Mr. Talamsuk nga se tirgal el smer ngar hospital ngaringa kar lolay ma Dr. Hancock diluk mong ngaringa karel rejem konklel el lwa IV el dangal mastrir tirgel adel mosmer el high risk arwa sugal ma arwa makita hartertir asbed el dima mail mastrir ru era el lolgabartir men dagal bol close mer ma dagal bol New England ra hospital ma igen aringil blal ngai arwa abriter mangaringir hospital lo labar elang mangaringa igel go kar lo mastrir tirgel New England tirgel mal lamos mer mang kabel oil klasin ngaringa o libl tletara ugrul agot libl sel yobo disgum timeter se ang mangatel morsal longerung en dirk ngaringa tletal dom gartir lo spega gid lorus el dirgum loringi ma hospital am namay
Sula Mr. Gafare, Gel Director of Health Services Rabluram Rigela, Luaisak mo September 20, a cell booster vaccination na giril mo malaria adal. Le after 8 months it yagidal el mother nam tal Pfizer amo weak maluben mo diagal effective. Kiran diag da take our risk al sum continue lol sisabra other akrel bela miso isur bela we e dirga wo hu segidal doradal el vaccination al sum tegidal fully vaccinated am lamo mi itut.
Kalak ko bak pa sa Dr. Hancock malgora sa modi sa igidil al tetele la talang tingil sa igidil long edel dose malung third shot e malko ko do sa dala ko tetele la wasem makarabo do rusra avelaw. So the question, Dr. Hancock, is about the third dose and about the effectiveness of or the efficacy of the vaccine after 8 months, and who needs it at this moment, and is there any visibility into when everybody else would need that third dose, and if there's, can you also explain the difference between the third dose and a booster shot as well?
And the risk, if we don't have it, are we at more risk now that it's already 8 months in?
So the first third dose that has just come out, that you may know of, the additional dose recommended for anyone that's fully vaccinated with a mRNA vaccine, which is Pfizer or Moderna. That is for individuals who are moderately or severely immunocompromised, which means their immune systems, for whatever reason, whether it's special medications or a health condition like cancer, that it's not as strong as the average human. And so what they've found is that they need 3 doses to be able to get their immune system up to the level where it's good at protecting them against COVID-19. And so if you really look at how this extra dose is written, this third dose, they call it an additional dose, not a booster, because it's actually a third dose to get those people whose immune systems aren't that strong up to the level that they'd like it at. The booster shot is actually for when you've had someone who had a vaccination and they have a good immune system, they had appropriate coverage, but that strength of the immune system waned over time, and then you give a booster to bring it up again. They are, as you know, are looking into whether or not boosters are needed. They're looking at a wide variety of studies coming out from all over the world, and including in the U.S. And when I say they, it's FDA and CDC And you've probably heard that the leadership of FDA and CDC, along with the White House, has come out and said, yes, it looks like we are moving towards approving boosters. It would be for folks 8 months out. And it's just another way to leverage that most important tool, which are vaccinations, to really help increase the strength of those vaccinations. Fortunately, in working with all of our jurisdictions across the islands, they have been preparing potentially for this booster rollout. We won't know exactly, till FDA and CDC have given that approval, but it does look like that may happen. Again, it's looking at 8 months. So 8 months, the people that were early vaccinated, they're just about at 8 months at September. So it looks like the timing is going to be good. And if you think about that some of those early September early vaccinations that were rolled out here in Palau and across the U.S., they were very limited numbers, right? That was when we didn't have much vaccine. The pods that used to give out vaccination weren't very big. So we're confident that when that booster becomes available, Palau and many other places will be able to reopen their pods and be able to get those boosters to folks if they get approved and get them out quickly to add that extra level of protection.
Mr. Talam sindi soda bol blaktak mong Dr. Hancock misada erul batengela yobo misada se longe day liobo mortirgel lomgodok mut mitut immune system ertir immune system ra batengeda ay gelot ngakla ser mang tirgel mitut immune system ertir awata tirgel mala kurula cancer tirgel mala mora bone marrow transplant tirgel malaba msisi steroid tirgel gidel adam ituta immune system ertir mung selongedel lorus ongedel requirement ndagal booster a booster akuk ngodel togoy a booster ak mlase tirgel adel diagal sera immune system na dingir ending la mo koram itut aigel lurerela ayobo abodolisi irtil mstringel longedel duk booster mabol blaqtaq mu CDC ملا تبدية أو ذسويل ناسي تلقى جد المئتوتا immune system رتيرا مم ملار أنجذي لوروس يا بوسترا موريول تلقى قبول بلغتاقلا
ngil odo songe mutelinga ma Dr. Yano ma Dr. Hanggang kumin dogon mutakla kami mentangartiang times ka gini mus me agrikel edin honge bundita mo hensi el al sugum tirgay del terung amlera sera Sunday last week sera Friday tamil tigtilo se to la bai garrat a question o se elang temotelal adamelo barak kita se el se namudia al ela al toktangar gide mo hospital gide longar artigam ko store omra masugum ela tirgel ner eli mo test tira Friday eu mutiklo se terun tede mong seguido lo sen magrar elang at what point e ko store ngilo se kala stop de tekera se agotel gero ongerul gera ase ela tirgel el toktang marnurs em no mes tirgal smer tirgal terror elang tige osisul timeetamal mol lo mes tirgal go bebira patient tir e tirgal tirgal mo test til wase dia lo singil mor tirgal smer tamla mai karak malo bendia ya ongedel gera wase ela tirgal terum malo betrigel go mamral me sois pro tirgal tiro la terra sebi lo yu del mora arbe bidarat tirigel nama orus ma alwe se lo yu del mora ad belau el nama amrus seguida kita ke
mo pa mogel toram ya rigel mul
algo toker rakaw
okay he mentioned 3 questions one these individuals who tested positive. The question is actually to the president. When do we close the border because of these two infections? Number two question is, those who took care of the two cases and now are seeing other patients, what happens to that scenario? And the third, oh yeah, and then these two cases, can they transmit infection to others who are vaccinated?
So I think as far as closing the borders, I think, with these two positives, that would not be something that you need to do. Again, we're finding that the vaccines are especially effective at preventing that severe hospitalization and death, which is our number one worry, even with Delta variant. I think, and I'll let President or others if they want to add more to it. The question about the hospital staff that are taking care of these patients is an excellent one. Initially, early on in the pandemic, there was worry that there was going to be a lot of spread from patients to the healthcare providers. But what we found is with appropriate PPE, knowing that these people are infected with COVID-19, it's actually very rare that a patient infects a healthcare provider. So these patients are in the isolation facilities in the hospital with the appropriate infection prevention control. So these healthcare providers are not considered close contacts because they're wearing the appropriate personal protective equipment to prevent their exposure. The other question about can the two cases spread it? So, fortunately, asymptomatic folks maybe don't spread it as often, but they can. And that's why the Ministry of Health has these folks isolated away from others so that their chance of spreading it, it's hard to really measure exactly how much somebody can spread the disease. And that's why if somebody's positive and a new positive and not a historical case, we recommend that isolation regardless based on it. So it's not that I can tell you how specifically infectious each one is, but they potentially could be, and that's why the Ministry of Health has isolated them appropriately.
Beko malu tila malungil kier. Mukotrule gira de lo mesra capacity hospital regit. Lo hacen tetela la da silo tagartir. O mesro hacen ngrasel risk el trial adel tira amosmel el wal selectira severe. Seguida dobal malboda be decide lo hacen namo gira del shutdown kada magarang. Di sel domeso urma atleta sel domesra iloisra other belau maklungela vaccination rate belau ngade ka sed richer seguida point el wasengira del mugasimel len ndika de sat la hospital gidel len alakla el mop toisra adel smel mosois bra al sel because kadam la vaccine seguida Trigal adre la mle triga asymptomatic. So amrari de mal de qabl qul dabt tril mar hospital. Di tawal first el geyser gid matangar hospital. Di triga ngasil el simra ablirir marubun hotel room tira de dabt tril mar hospital le triga de gal ser. I mean degal ser wal ngari raktir. Te dio barakt din degal sem grado sa toqtan yo no sugar se la. Ndia. To barakt din degal ser. Ndia to barakt din degal ser. Mong betriga sil mo tok. Sea ndi sel gira de mo triga de lo barakt te amral smer. Motos pe ayegidel sel bol tok tri yegidel mral yegidel amasa sem kada kadon ngosong sari di sel dur tuiro ur mo omsu mai disira adar belam lama yo bortir en adekal selu klomesria Dr. Henka ada kadang ngalak persegi del mo record se que del mo simana ele maybe asekal askari mo wai sel tetela la kwamrela. You know, Dr. Hancock, I think it's important for you to share the number of hospitalized patients now in Guam versus what it was last year. Because the question is, so when are we going to shut down when there's too many cases? I said, well, first we have to be overrun at the hospital, but we're not, based on data, based on the size of the population that's been vaccinated, it's highly unlikely we'll ever have to shut down because we'll be overrun, right?
Right.
That's my understanding.
Yeah, and of course, I mean, you guys will adapt if there's different variants. But with the Delta variant in Guam, what we're finding is, you may have heard Guam, there's many cases in Guam. And when you look at the surge in Guam, it's almost a year ago that Guam went through its surge in the fall. That really was the biggest surge in Guam. And as they found cases in the community, they found that sure enough, the number of hospitalizations went up as well as the cases went up. And the peak at that point was 105 people admitted at one time in the hospital in Guam. And that was very difficult for the hospital to maintain, and they needed to get extra help and manage it. Now we're going through another surge. This Delta variant is very good at causing infection in unvaccinated individuals. So we're seeing many cases. But the number of people in the hospital in Guam right now is 20. So we're seeing that there's a much larger difference, right? That the number of people that are getting severe COVID is much lower thanks to the vaccines than last year. And so that's really why, if you look in Guam, they haven't really shut down like they did last year at the time, because the hospital still has some capacity there thanks to the vaccinations. And again, it's that primary thing. The vaccines are so good at preventing that severe illness, so it really helps prevent the need to shut down.
Sala, Mr. Presidente, tiala mora tirgala dara yo ozil girela sel contact tracing. Homelgot na singanya 26 sel close contact blam tested negative. Ela sel flight el mera August 15 tirger rogul passengers em la sel ngarbela automor sel el 50 mo malera testing mal ube kom la start el modo du tire mo tested tire.
So tirigel mler August 15 rokui amle tester sera Friday. Tamle over erul darta ame tester sel silsa. Outra tirigel erul darta ma ode agundas amle 200 toria me tester sel silsa. Tirigel teru amle paseti. So igual deja el mut el tester seguido el tester day 5 seguida wal play clear tir. So tirigel tool el positiva mildang au ulmo mumleru la contact tracing hale qadi talib mutal smodis el contact tracing so sayid el milgat taqla far wa sa contact tracing close contact sa tirigel adel ulbangel tirigid el smer el at least 6 feet ad longlir el mobdul ngara 15 minutes or more sayid qa definition of close contact tirigid el mlamadang al 26 amla test maqadam la sa amla test negative okmong mlaringia waner tirigel mle test el positive and then naqdgu mle ngoriaq el mor tirigel secondary contacts tirigel gu contact ringel contact di el time el sum tamle dim le negative rokui engwal wadi mlor seikiti egu korastope mengila gu pesel let's say ngar bebirar madang el mle close contacts tigai del terul smera elang tirgel mutal mera testara onge del klebsei matamera klugo longeru lurior tel mutal test el mutal yegidel antigen ma yegidel el PCR tester klugo el sugum tadiga negative etmelo qadamel mol mluaseng disegidel circol ratigidel contacts to mesertir sugum ngarinya ku kwan el madang enen qadgu klmutal morsegidel walongeru daw ratigidel contacts tirgel contacts Aldumak malgol way sing malbetukar adalom bodong al mel el pekik leta wal kora kantak tertiga gidel kantak ta. Matirga dia bodo o mesertir unless tertiga gidel kantak awal bol positive. Ela selbon merek selong edel test selong edel klebsel test walong erul test. Egadam ngi le mor seguid el true el klebsel lo goring gal toktang lo se seguid el period. Seguid ya isolation period maluben quarantine period ar contacts marsmera. Seguid milga taklil wa sa CDC tadio isolated till 10 days and din dia al tester tir. Ndi gida ko biander say magadamo tester tir selong ang true el klebsel. So tirgal terul smer matirgal rogul contacts about the tester tir raveiten. So the test negative and then the release tir from isolation ma quarantine. Also ta malmol mal positive el mutal extendra a period isolate malu with quarantine.
Bilgulak mo tirgel terung el mlasil skogira August 15 adimlak al transmit tial rak el mo tirgel restra passengers.
Sab edel kumul waisay lakadam larong wasirang kal adal wasay wala incubation period malubeng time mo ultra adal sab edel testing il positive angara edel klebsay matira kamle email klebsay at me test min sab edel kora safely sel wasay di say edel time le email klebsay adal ngole belgerda en ditira edel terul adam le test el positive.
Sure.
Dr. Hancock, you mentioned that the incubation period for the Delta variant is 3 days. Is that correct?
Sorry, yeah. So that's the median.
Yeah,
so that's the middle part. It can go longer, and that's why quarantine is longer than 3 days.
Yes. And for the other variants, it's more than that, more than 3 days.
So the median for other variants is about 5 days. Again, the long end period is that 10 to 14 day area. Yeah.
Okay, so my question is the approach that we're heading to, whereas we will test the passengers the day after they arrive. Is the testing will it be able to test whether a person is positive with COVID-19 if the incubation period is 3 days, 5 days? If they are tested just the day after they arrive, will the test be able to detect the virus?
Yeah, excellent question. And because Delta variant has that shorter median incubation period, it means that you can identify it quicker through a test after somebody's exposed. But we don't know when people have been exposed and when they might turn positive. And so there's no one test at like the perfect time that's going to catch everyone. And so that's why, I think your approach or Palau's approach makes sense, that you have an initial first test. So hopefully you weed out a certain portion of folks that then after they arrive, you do another test. So you're identifying people early once they're in Palau and in restriction of movement. And then you're doing that test at day 5. So each time, although none of them are perfect, by adding those up together, you have a fairly substantial reduction in the risk. But again, nothing is 100%, but it definitely makes an impact by adding those extra tests.
Just a second question, Mr. President. President. Mlaring leadership meeting ra omira tel press conference understand the sa kuk seltara brancha ra government tamle soril stober tialo marail ngara tadilur kaw mangra kuramle discuss ngara kuramle reaction tirel girel tial tirkal terul positive melukot tirkal ku prestra leadership kadat wasa kada malasamal marurar adra balum men diakal salbagik le ya reality ngaringar adal kuram la panika ngaringa informational gimgilal wase atras kurbelak medel 17 ngal gamle absent rel al sils mang tiogel wasen kuk ngaram le reaction sel restra leadership. Thank you.
Gotrula meeting rel al sils kung maral waseng malmle productive emlonet eler arbek leadership logeragir senators delegates governors trigger ugol narsel sorry logeragir emlonet logeragir mora Dr. Hancock ama of course ngira ite gim narsel longera rogul ger magunda seng lobla tak kadirgal akmadila seng klo aseba krengar our parents and we understand or segidel el seba krengar adam adil lobt triangle gil mora school aseng lel bolung tiarak yesem lobla tak leng mal le klo no emle optoy sar adal absentra askure al sils betokor tira al amiri gidel waseng ngarakad mokmur el al sils mong kumaral wase amokte gara meeting rela masemle meeting long ila leadership om katakrin wase gidel adar bela selba akla tadam la vaccinate يصير قلت الامبورتنت المسج الاول من الغنية دكتور هنغا قاسي شو من شامل سوق كليان الجيم make sure you get vaccinated there is no excuse ketika rumah nang الجيم go get vaccinated saya قلت كلول ناس ولا شيء أدري ولي ديرغل سيل دمور تيال غرا لنغر ألذر روغوي مترجين نغل جات نغرا يكرر أبلور بيلا الماء وكمل أولدين غريد أو ماء مو ماسك مكرجيك أمره لما elakam dimo mais maise egida ngiria del motnagal imol blu e gainga seu ndiregal mlo bla takre la mat ndiregal doctor hen kam nom gatakli al sum triye del ngal ngara 12 0 to 12 angwaracht indigal misisi wal indigal borsel severe mild atol speria mild or asymptomatic egida ado dengay mong giren mo salba akran dia adam maadil dengan sekarang kalau masih in more school and they'll be safe al suo mong tabagik en malungin halol ang maska hindi kal help protection ako na sa tukol school am la implement ro sir sense o mask hindi kal prevent the spread mo na lang hindi hindi kal mo encourage sa rogol sense must be vaccinated sensei sedongi resel final approval ara sedong waseng clearance ra FDA giret tial el vaccine el ayuda more seguid el level wase al sumo ka sensei girem no tia vaccination card ra adang sel ana next level ra o si sakling wai gelo lo ro la kabana ra komre lang al sumo ta mo ba vaccine card de ka sem mortia de ka sem morse nga gire la bela el mon more seguid el point ending the Perimal towards final clearance ra FDA, which we hope it's going to come this next month. Igida namo sa edek murtilo sa igida a requirement. Hindi tida do dangali. Ako tium etul pasent ra adre belal maklolat amlang o ayobo. Malimisan makasal ada diri kan ayobo. Hindi diri kan encourage tilo sa bom ngu. Leng alcom masabak rangal ka ese abestel se emrulil ngar alem le kal dil borka ngar alem al mora atrigal ngi karel ngal yedal gida butigar muderti so sula abong Bernadette.
Mr. President, you talked about getting vaccinated and vaccination is not mandatory, I understand. So how would you encourage those 18% to get vaccinated? I know they are included with them is the under 12 years old. And Dr. Dane, when can we expect a vaccine for the 12 and under? And there are travelers from Taiwan that fly in that come in Palau that are not vaccinated. So how effective is it for them when they receive the vaccine upon arrival? I mean, how when does the effectiveness of the vaccine kicks in? Thank you.
Okay.
I'll
Go
go
ahead.
first.
Yeah, go
Okay.
ahead.
Yeah, so unfortunately, the vaccines take a few days before they really start to prevent COVID-19. And so vaccines can't be used as a prophylaxis, but at least getting somebody vaccinated. So anyone that is in Palau that's not vaccinated, you want to get them vaccinated. And so even though they may come in and they're visitors, they're in Palau unvaccinated, it's in the best interest of your community to get those folks vaccinated. And then as far as when can we expect a vaccine for those 12 and under, I wish I could give you the answer. But unfortunately, we don't know yet. I know that there's efforts to look at these vaccines in these younger age groups, but at this time, there's no certain point that we can expect those.
So first of all, the Palau community has been outstanding in getting vaccinated. The adults that are eligible, we know about 99% have been vaccinated. Of the 12 to 18-year-olds, by far we're well over 70%, right? 80% of them have been vaccinated. So, and there's more still lining up to being vaccinated. So, all we can say is we've done a great job. There's a few out there. We encourage them to come and get vaccinated. And hopefully, eventually, there'll be the vaccine for the 0 to 12. But for now, we just wait. And I think the initial estimates were some early next year, right? Was what I've seen. It could be later.
Potentially, yeah.
Yeah,
It's hard
but
to say.
It's hard to say.
Maldilas the question ke President mangora ngara gora word that Taiwan tora Taiwan gidel tel sterile corridor gida metara gora kansen tira te gidel masibling monia se na blue law ngaya gora indication wasetamo change sa protocol el gidel tel omaral me el mosto van uben malumol maleng ngara gora processor say
Dia meran le sebo karmut, sera gotera bodo dengi mentim le sig del tan kado kai sera ambasador Taiwan, mulu ai sera Taiwan CEC. Matamal el understand, em le sorin mo dengi detail, el wase tirgat tam largel me mil garang. Kado mil stira yerogol information, matam ne sing imported case. Mendim le sarudera afternoon at tamal gol melo sen dia di mal mol leng radra Taiwan mal to imported case til direct. Yem dengi lo se ngidim nguem container ngiem controller ngien you should be okay. Mo kado ngane am lo so da se tramos to balu dia mal mol. Mo ngile algoritmo mas el morela flight. You'll be okay. Sula.
Mr. Presidente, tira para la stimulada Palau Radio.
Good afternoon. Good afternoon. My name's Irene, and I'm here with Palau Wave, with the SWAL program, which is an open platform for the people of Palau. I'd like to acknowledge the Lady Doctor and Mr. President, Dr. Haley Cash. Thank you, and thank you, Dr. Hancock. Thank you, Kafar, my classmate nga karariter. Maldi, there's tang ay kal garik. There's tang andi ka atrablu e presidenta. Oldur to ase elak man nga sularitel no ngils mo diesel contact tracing. Et ilul dire kal tokor bela mo rahmal mo blakatak. Dil asel ko ngerung asel gerel tele restricted restriction of movement. Masel garirar atrablu ase Katawasang nga ringi, laptop ta press release, immediate release, may kalbatokal babiel gomoldurok, klar at rakapilment. And the tanggal mal mangkare enforce sa saigang, lang nga ringi tirigel ko rahmal diol tirak na silang nga matamiw mamatamam. Hindi sila kitokra di oli taigal, restricted movement. Melang nga ringi aptara atrapalu, President yang atira kan mereng asulela kuk minister mutu le kama makora mong atatu
Hindi ka rin sel force look mo mereka tapos next.
mal diungil.
Okay. So kakpa pesat ella kafare.
Sulang Irene raw daswal. Man marat to koy so kad madangil wase sera au era boringa gat tablol gay sa kadumil sa mask direct kalim la kal salbato kar adal merde oltirak kersegi de longit mang el time material mler el alsil sangaria mitigation orders ang ilay sa alsa niya director of public health del man makataklil wase gel lugot talayim el klubsera selamay engiril mga sadra bisir ma omrolir al salabalu aldi mo igel ngiya orud el giril mo kun si irar adal mawrior si il morabang si iral morastawang al mo maarakalir si iral moragel shobay mapasyol ngiya certified ra abi oti ma PBA el say gidia
Hindi ka lungil albora school. Hindi ka albora school.
Hindi kita madangil no se umasindra ngal kan mea adirga kan nga orus. So hindi ka albora school.
Hindi ka albora kamaldil.
Hindi ka albora igigid ng kura muklolo hindi bulwa kamaldil may gilesya ma. Anait marget until atungusel day 5 test. Say gidi. Sel tokora pulis. Of course hindi ka sabela ministry ra hel tuwa del momangara erul dat adra. Vehicle seals will make sure hindi ka magidirect lo langit tara adra bulul wasi pomol nga sir kamamal lomaklat ka el suguma ada mal kura dekalot tirak dekalom karew eng sa el mutaw tara la le sige mitigation order aman makatakil wasi at suguma ka ko tay gagidel ngati gidel order and sabi el mutaw tara la mang ngariya process el iblam got maklaim adra Ministry of Justice el sabi edalot tutukla adal sugum muli tay gigidil ngar sa igid mitigation order luli mukra testing wal sugum ta dekalo ordering sa mandakal belo larsel day 5 malugin day 1 sa edalot tutukli la makadol ngis tara adra bulu sa takay ngisew o masindra adal me adir adat adal belaw mong sugum ka matang la adam lo sindir gamlay akli yal sugum hindi takang emot taklil mer kam
mel asay gidal hotline kami wasab edal diregal ngaray kal media melkora atal wasen sab il call the hotline al sum komestrer atal daklol tirak partial restricted movement ngo sisul dengwan ngaray kay gidal press release
diregal lise kafara ngari sel ngeso el dolari ngaradio ay madire gal HHS el mo help rigidel rulia sel contact tracing lo ya dengwa mong seguida mara la urior giral so hopefully by end ra yire mna mo urior sea gol rigid diga danas miga udo gadamo 3.6 million aran sel system di gadamo mo kor seguida part of the effort rigid keeping us safe no
Mal masaurat til ang president til Europe am lamoy opatil ay gid den dire kal dakal balkula ko kal ngaring yalla et tirgel doctor stal dakal tirak lel lorurar bebil mo mata mela kad more say gid el cook restricted movement et poratogorasyo by as of Wednesday August 18th and 154 companies in Palau have been pandemic certified safe for you. Masaygid yaw ngil to ko elang ka ma-minister muturab all adu ay kahit hindi ang selso ko makuksyo ba di kal register the member of Palau Chamber of Commerce mandiya gibsan matangali en gukti kal sabamil ko rakay ngesew monitor ay gigit ay encourage tir mo pandemic certified makora dioger tial gukarila atarabulul wasay kal stoang Tabato kara adal matuturay kal stoang rapita mabitang surang al super center ma WCTC ar adal orer al tato mas kandir adal matutura al selar bebilen de kalo mask emom tokora to orbitara kiaser tangarangaran mal kay waged et ya kara adal mal matingel waseng kang gukta al dir kam larak kwamel may alubeng kang guk largel may meseng kadal am kararingi
ya ka malungil concern di so adal muktel marenga sulir adal balu masyobail again dirga ka kura mandate tel tov de lo sebom enforce at kura mask ma bebira restrictions se bai ditir la gutmok la ye mung ultoy ra situation la time mung adagi multov da mandate hindi na kamaro ra shobal dingil mesa adal lumdaswing ngirel gutmok ra mungarakel sobokli en sabil malukol yalla kalo ultirak en sabil refuse a service mung again katambre nga sulir adara belum maka korupsi shobal la titil na tega initiative mung kada mutal yolngitra aklay nga sew ma support tara adara belum lo se mem da kay nga sew ngutmok or segi de laldo sa da mask hindi ka tutalala ada mandate tamas kya ada lo mask luwasay malubong wasay it's either you're wearing a mask properly or don't wear it mang segi da direct lo ngitring lo sel so makamuras to ang mesa adni dil adal al okya kamal cashier mangaral ko di dargak lo tetela lo mask direct kal mo sel reminding lo sitila lo moruring ada kal defeat the purpose of mask mong ngungil time the practice and God forbid albonia community transmission el ba algira man mandate already kada madu am tangalit talitan so ang say gid ngdel ni tra coloring ra atra balu ma support ma assistance ra gay gid rogul doru
dire de portali lo sen area training al bol contact training August 26 Thursday at 4 o'clock el pandemic safety training el Moria Civic Center mo kada encourage te gid Tokol shoba businesses maybe they can member chamber please ebo oje
8 a.m.
diwlo yes ngamura itra tutan mo forra kapsingi son tal sales civic center sula
Pai pok tulir to karam rigele. Thank you so much Kafar.
I see
And for demonstrating also how to wear a mask. That's important because people who are not members of our organizations, we have no say. So since it's not mandatory, then I'm glad to know there will be a training. So the training is going to be this Thursday at the Civic Center. From what time to what time?
8 to 4.
From 8 a.m. to 4 p.m. So all businesses who are listening right now, this live conference, whether you're a chamber member or not, please go through that training. So do it for everyone. And it's of course free of charge. So that's good. So my last is actually I just want to acknowledge Dr. Yano, President Alela COVID. He did a very nice video about chewing betel nut and how to be sanitary, health-wise, hygiene. And I asked him today, earlier before we started, if there's any possibility that the media could play that again for the public. And I'm saying this in English for the doctors here. I'm sure you've noticed that some of us do chew betel nut. And I'm one of those who's still praying that someday it will not be in our hospitals anymore. So I'm being honest.
I see.
Okay, my last question is, what are the side effects of these vaccines? Ngaragal ko koratal malele, toktang le ngaringa, ikal rokul kaltola koratil ang ngaringa ko bungararingi.
Yeah.
Pamsulang.
Adverse reactions. Why don't you,
Yeah, great question. So these vaccines have been given in the U.S. now, that includes Palau's numbers, it's over 169 million people have been given these vaccines. And during this rollout, there's been more monitoring of the rollout of these vaccines than any other vaccine campaign in history. And what we found from this so far is that these vaccines are amazingly safe. But there are side effects, and side effects are expected reactions that some people have when they get the vaccine. And these are reactions or symptoms that the individual can feel as their immune system learns how to fight against that virus by the training that the vaccine is having the immune system do. And so the most common of those are fever, headache, feeling tired, pain at the injection site. And so they find that these symptoms can last for a day, 2 days, for some people very rarely 3 days, but then people feel better and don't have any adverse or long-term consequences of that. And of course, individuals can take like ibuprofen or Tylenol, acetaminophen to help with those symptoms if they do experience it. Not everyone has those symptoms, and if you don't have those symptoms, it doesn't mean your body didn't respond well to the vaccine. It's just some people have it more than others. The things that we're really monitoring for with the vaccines are adverse reactions. So if there are any conditions that occur more frequently in people who are vaccinated that are higher risk. And you guys may have heard that even though these vaccines are extremely safe, they have identified some conditions that can occur extremely rarely, but do seem to occur slightly more frequently in people who are vaccinated than those that aren't. And so one was with Johnson & Johnson, the Janssen vaccine. There was the increased risk of clotting that was identified. That was one of the reasons why you may have heard it was placed on hold while they evaluated it. And upon evaluation, they found that this is extremely rare. They found that some people were at higher risk, so younger women. And so people are more, they asked people to be on the lookout for it, but it's so rare that they felt that the benefit of the vaccine way outweighs any risk. The other ones that you may have heard more recently is myocarditis, which is inflammation of the heart, temporary, that can be associated with the mRNA vaccines, especially tends to be in individuals or younger individuals when they're vaccinated. Now, this is temporary and has recovered. They're monitoring it, and they'll continue to look at it. But when you look at the risk of Delta virus or Delta variant of the SARS-CoV-2 virus, that infection versus the really small, it's on the order of like tens per million people who have received the vaccine that get it. That when you look at that risk benefit, it's much more beneficial to have the protection of that vaccine than any small risk of that myocarditis. And in fact, they're finding that for individuals that have COVID-19, the actual virus itself, they actually have, it looks like they may have much higher rates of myocarditis than any of the individuals who are vaccinated. So again, when you weigh the risk benefits of a really extremely rare thing that may happen to only a few people from the vaccine versus what COVID-19 can do, the benefits of the vaccines are way outweigh any risk. But we continue to monitor, and just to reemphasize, in the rollout of vaccines, these are some of the safest vaccines. They're tremendously safe and very effective at preventing that severe illness, hospitalization, and death.
Zongil Irene, clear, eh?
Ramla ngala krerul sigang. Ang daseng alam sa edel molungul ma Wednesday adan di wile di drutel mal di menga sulir arbekla tara blada subira igan meeting era chills sing said mo improve the communication ma iosia active lang magafara mo lao aisa se mo bekal chills lor to dara ukka brief summary so everybody is up to date legum daswa will communication arul ter adam tomodaga tasal ba aklarandire mo ala laklarandire ndekal sal so bagarandire engal tegal terut toktang amagya de rule sunday mataman mo na mitra matira yal ka cross agency ma NEC rak klugu legal help and make sure a plan ergida mograd refine the rule man mo address again no will yeah possible album leather future para di mga suliw el samarial o toda aisen marablu e ono se orgida tial ngara ledel lo aisen adrablu ay gero gunya album leather o mal sulang ya dia sura makal tangat rol mol mol tangat rablu belau makal tangat ergida ro mal sulang
Adalo ay seguida mo lo la press conference gita al togo bet press conference gita al sales bugura sulit tiel partner seguida do no tiang Maria Chor gidra ngarel belau le ko Paradise FM 87.9 makumbali gidra PNCC lo magar gidra belau mai krela blulav madira kal Palau media kansol ma kansistra private media belau of course tirge partners gidra ngania TMC television ma PWFM radio ma TV madira kal tia belau newspaper ma Island Times newspaper mranga sulir bekla de mal invite a Rogul ade Rogul adra medial me la va vivir la cuestión se me mete la bebula tebra Wednesday y llamar el tema la ondi brigid y mal misaul y de mete aquí de hoy día colguión un el velar tel bitam el polo regular program radio adra blue